has to look tired, okay? A woman does not like a man to look relaxed, okay? So he has to look tired. So if we inject anything here to make that cheek more convex, it is not going to look very good. Usually for men, if you're going to be treating their cheeks, he has to have a depression more or less here. And in case of Rafiq, it's completely fine. He does not need that injection to happen. So we're not going to be injecting this for him. In addition, definitely the zygoma is a no-no, okay? If he tells you that he does not want it because he wants to look good, okay? So we're not going to be injecting the zygoma. All right, Rafiq, we're not going to be doing that. The thing is, to make Rafiq more masculine, to make him ooze as he's sweating right now, to sweating testosterone, what needs to be done is to augment the chin. And when it comes to the chin, this is the area in which you can really either feminize or masculinize a person. In men, it's usually the other way around. So it's easier, you can easily masculinize a guy by knowing exactly where to inject. For women, you have to be very careful because you can masculinize them also. The only beautiful woman out there who has a masculine lower third feature, I don't know if you guys can hear me, do you know who it is? Somebody very famous who looks very masculine on her lower third. You can shout it out, I can probably hear you. All right, no, I don't hear anything. But Angelina Jolie has a very masculine lower third, her chin and also her jawline. Okay, we have to focus on two areas. The first one is going to be the chin. The second one is going to be the jawline. So let's look at the chin for a guy. A man's chin, what needs to be done basically is that you need to draw a line from the oral commissures. So for us to augment basically a man's chin, to make it more square, we have to draw a line from the oral commissures. So the oral commissures are here, and you draw that line basically downwards, and you do the exact same thing on the other side. This is the line that you need to kind of follow when it comes to augmenting a masculine chin. For a woman, it's a line that's more central, based on the ala of her nose. So it'll be a line from here, going downwards, and this is the point in which you will inject that for a female. It's mainly just here. But for a man, you want to extend it to the lateral side. You want to make his chin square. You want to make a woman's chin more round. So that's what we're going to be doing with you, Rafiq. We're going to make your chin very squarish. Okay? Fantastic. So after we do the chin, the other location that needs to be taken care of is the angle of the jawline. As you can see here, Rafiq has a great angle. Okay? I don't have to do much, but I can definitely augment just a little bit to increase a little bit of the masseters there to provide an even more masculine look. So what I'm going to do is that I will draw a line more or less here where the angle is. That's where the angle is. You draw a line on the jawline, and then a man's angle here has to be either, usually it's not 90, but it's anywhere between 100 to 110. So we draw a line this way. And that's basically how we're going to recreate his jawline. That's exactly how it's going to look. This is about 100 to 110. The more right-angled it is, the more masculine it becomes. After you augment this area, and there, you can, for certain individuals, okay, you can also enhance a little bit of the masseters by putting a little bit of filler onto the masseter itself, okay, just on top of it. And this will augment his lower third. His lower third is going to be fabulous. The lower third, especially for a man, is an extremely high tension area. I need something that is quite strong. I need something that will also provide me with projection. I don't care much about volume rather than more projection. And for me to be able to do that, and you just heard Yelda talk to us a little bit earlier in terms of the rheological properties of the fillers that are available, the one that works very well for him would be intense. Okay. The nice thing about Neauvia here is that they provide you with an intense that is catered for the masculine guy. Okay? So if you look at the syringe that we have over here, let's look at the syringe, let's show it to them. There we go, yes, a little box over there. It is, look at this, we're going to be injecting you with this product. Okay?
Very nice.
The filler itself, and you're going to hear me after I finish the injection, because I'm going to talk about all the different types that they have, is consistent of 28 milligrams of HA concentrated. Okay? In addition, we're using a PEG technology that will provide extreme high G prime in addition to cohesivity. This filler pretty much acts like an implant, but an implant that, say for example, God forbid something goes wrong, or he doesn't like the results, which is not really going to happen because I'm the one who's injecting. Okay? What if, for example, if you want to get rid of it, we bring in a little bit of hyaluronidase, it will go away. So unlike any of your surgical implants that will stay there, will look unnatural, this one will look extremely natural once it's going to be injected. I'll give this to my lovely assistant. All right, the last thing I wanted to mention are the danger zones for the lower third. Everybody knows the anatomy. I'm not going to bore you to death. The only two areas for the lower third that you have to take into consideration are the following. The first one is, I want you to clench your teeth. Meaning do like, ah. Yes, and look that way. So here, do it again, keep doing it. I will feel the masseters right in front of the masseter, right over here. Okay, right there, very, very deep, onto the bone. That's the facial artery. The facial artery comes from downwards, moves upwards here, and then slowly starts becoming tortuous, reaches this area, divides into both an inferior labial, a superior labial. So usually when it comes to guys, you have to be very, very careful, because guys, if they see a spot of blood, they're going to start, fainting. If they see the needle, they're going to start fainting again. Okay? So in normal circumstances, I usually try to even calm them down, or basically just tell them to close their eyes. Most guys are like that. Fainting spells happens with guys more than with girls. Okay. I would pinch in the skin. I like doing that because what it does is that it really, first of all, provides a little bit of pressure, takes some bit of the pain, okay, and at the same time also cuts down on the bleeding. And we go deep. I've touched a little bit of the bone, and then I come out. Once you start hitting 40, and I'm sure Rafiq has the exact same problem, you're unable to see small objects. And it's very difficult sometimes to find where the hole is. All right, Rafiq, here we go. So I'm going to introduce my bolus. It's right there in the center, and inject extremely slowly. I'm using a 22 gauge cannula. I'm going to be very honest with you guys. I switched to using a different cannula when it comes to injecting this product. The cannula that comes with it is not the greatest. Okay, so I'm going to admit there. So if you have a cannula that you like to use in your own practice that you're comfortable with, it's completely fine. Okay? So just keep that in mind. It's completely okay to inject using your own cannulas. Just because they provide you the free cannula doesn't mean that you have to use their cannula. So I've injected a bolus right now of 0.3. Rafiq, how are we doing? You doing okay?
That's okay. Did you find the hole?
I did find the hole, yes. Yeah, I've been injecting for the past 5 minutes now. If I haven't found the hole yet, I'm currently literally blind. Okay. So here, by putting it right in the center, right straight up, I'm actually causing an increase in projection of his chin. Now I'm going to move to the lateral aspect. Still very close to the bone. Under the mentalis muscle. I'm going to ask him to turn this way. Perfect. You're going to start feeling me just pulling and pushing, okay? Okay? Just relax. A man's chin is actually very, very thick because of the skin that he has and all the musculature. So I'm going to add a little bit of filler right there. And I'm basically following the imaginary line that I told you about. How are you doing, my friend? You doing okay? Mm-hmm. Good. Yeah, keep holding pressure there. Okay. So I've injected a total of 0.5 right now. I'm really trying to maximize the angularity of his chin. And I'm injecting mainly on the left side. And I'm going to move to the right very, very soon. Are you guys able to see that? Oh, perfect. You guys are able to see it. And it's projecting very nicely there on the screen. Rafiq, you are going to be fabulous. If you don't go out there and find yourself a date for dinner after this, I don't know, that means I have failed. I don't know if you're with someone, But after this one, you definitely will be.
I'm going to try some application.
Let me know. Let me know how it works out for you, my friend. All right, I'm still augmenting the chin on that area. I really want, they require a lot of volume, these men. Men really have that need for a lot of volume to provide that little, you can get me another, to provide that volume there. And I've injected the total now, 0.4 in the center and 0.6 onto the lateral aspect. I'm underneath the mentalis, and that's where I'm injecting. Can I have some gauze, please? No gauze. Perfect. Vic, I'm going to ask you to sit up. Sit again. Let's focus on him right now. Relax this way. And you're able to visualize how this has become straight as compared to this part over here, which is still pretty much on the lower side, not as defined. This is more squarish, and this is still on the lower side. Relax, my friend. We're still not done with you yet. I'm going to move to the other side because that's where I'm going to start injecting. Again, I'm going to find that hole there, Rafiq, my friend. Man's skin is so thick. Look up.
You explore my old hole.
Yes. Remember, you're not married to this one little small hole. If we have a problem, just make a bigger one. Hold with your non-dominant hand the area of the mandible, basically, and move your cannula parallel to your fingers. Switch. Perfecto. How are we doing, Rafiq? You doing okay?
That's okay.
Any pain?
Don't worry about me. I'm okay.
Okay, I'm just checking. I'm just being nice, Rafiq. I'm just being nice. I'm a nice guy. Even though the team has told me that I have to make you feel pain.
Really?
Yeah, I don't know. They don't like you.
I'm going to ask that.
So you can see how this area, as we're injecting, is simply rising upwards and forwards. It's got great, fantastic results, and it's immediate. Look at the jaw, the chin here. It's really getting defined very quickly. Remember, you're injecting quite deep. You're underneath the muscle. You want to be underneath the mentalis. You have to. If you are not underneath the mentalis, what happens is that the results are not as good. The filler lies over the muscle. If he starts to talk, you're able to be visualizing the effect of the filler itself. You're doing really good. Any questions from the audience? I mean, come on. I mean, there's got to be some questions that you guys have to ask. So if you do have any questions, please let me know. I can inject and talk at the same time. Everybody's quiet, Rafiq. I don't know.
Yeah, I don't want a question.
You're talking more than they are.
We have to focus too. Don't worry.
I guess so. You okay?
Yeah.
Okay. Excellent. I'm going to put the whole 1 ml on you here, my friend. Last but not least, I want to square this off. Turn it around again. More here. This is a very thick product. You have to really work out just to be able to inject it. Like I said, it works as an implant. And with that, voila, let me see what they're saying. Oh, excellent. Look at that. All right, my friend, let's have you sit up and let's see how you look like.
Okay. I'm ready to go.
You ready for your spotlight?
Yes.
Look at him. Zoom in on his chin. Look at him on the side. Look at that. Look at how squarish his chin is. Damn, man, they look really... All right, so how long will it stay? This product, because it's a thick product, high G prime, very cohesive, can last anywhere between 12 to 18 months. Okay, so that's your answer to the question. 12 to 18 months.
Second
Second question, please.
Ödem oluyor mu işlemden sonra ödem?
What's it called?
I don't know the means.
Birkaç gün süren ödema. Edema.
Edema. Is there edema? Okay, the nice thing about this, because, look at yourself in the mirror. You can look at yourself while I'm talking to her. Okay. So because of the PEG technology, basically the occurrence of edema is much less compared to HAs that are cross-linked with BDDE. And that's been shown in the lab. There were a few slides before that shows that anything that's usually cross-linked with BDDE has a higher tendency to swell. This one here will not cause any major swelling because of the PEG technology there. All right. For the jawline, you feel where the angle is, and the angle is where my thumb is. You go in, touch a little bit of the bone there, that's where the angle is, and then you slowly come out. And you give it to my lovely assistant. Hardly any bleeding, then I go in with my cannula. I will place in a bolus right there, because I want to recreate my angle. So I place in my bolus. Rafik, how are you doing? You doing okay?
Yes, okay.
Good. You better be okay. So you put in your bolus, and I'm injecting. I usually, for my bolus, I would inject anywhere between 0.2 to 0.3. So now I've injected 0.1. You'll be able to visualize the angle as it goes up. So if you zoom in here where the cannula is, you'll be able to see where the filler slowly fills up that angle. Now we put about 0.2. There you go. I can see what you're saying. Very good. This room is extremely hot.
Mm-hmm.
That's right, huh?
Yes.
And I thought it was me who's hot.
No, it's old hotel.
It's an old hotel?
Yes.
Okay. And now, you're going to go across the jawline. Here, your injection is not deep. Your injection is actually superficial. Reason for this is that you don't need to be deep, and the problem is that if you go deep, you're going to nick the facial artery. Even if you're over the 22, there could be a chance that you might hit it just a little bit. Now, I'm augmenting his jawline. See, it's a simple straight line to his jawline, and that's basically what I'm trying to recreate. It's a thick filler that's coming out, and like I said, it will be an implant. It will just stay where I want it to stay. Slowly, slowly, and surely come out. How are you doing? Doing okay?
Yes, I'm okay.
Good.
Did you find the end of the way?
End of what?
End of way.
Yeah, everything's fine, don't worry. You're doing okay. I'm not lost. And then you would turn upwards. And remember, I want you to look up. No, yes, this is fine. What you're trying, look up. Yes, perfect. What you're trying to do is that, remember, the degree here of the angle is supposed to be about 110. And you slowly start to inject. Are you able to see? Yes, perfect, you're able to see it. I want to make sure that everybody's able to see my injection as I'm doing it.
I don't want to see.
Yeah, you don't see. Nobody's talking to you. But remember, I don't live here, so everybody else needs to know how to do this. So when this goes away, Rafik, you need to go and see them. One of the reasons I work out in the gym every day is for this. This is really hardcore. Really, it is really, really hardcore. And you're able to visualize how the angle is starting to look. Let's have the cameraman zoom in here. Swear to God. Okay. Perfect. This is hardcore. Here you go. How are you doing? Doing okay?
Good, it's okay.
Excellent. I want you to sit up. Sit. Excellent. There you go. Look at the angle here. Look what we have just done. Turn around this way. There's nothing there. And look back again. Look at how sharp this baby is. You should quit your job and become a professional injectee.
Okay, I do.
You can ask all different companies to inject you. This one. Go in. Remember here we are superficial. Go in. We went all the way up to the chin, and then you slowly start to inject. All right. Any questions from the audience? Come on, there's supposed to be 2 moderators there asking me questions, engaging the audience, being as interactive as possible. It's not every day that I'm in Turkey here, and I'm leaving in about an hour from now. So now is your chance. I don't know what's wrong with them today. Usually they ask more questions, Rafiq. What happened?
No.
What do you think? They're shy? Maybe they're shy. Okay, so remember, find the angle, inject superficially, right on the jawline. Make your bolus more or less on the angle itself, and then turn around to recreate the angle. Turn around. Turn this way, please. Yes, thank you. Look up. Perfect. Now, so you hold this and then go to the other side.
Surprise.
Hello. All right, guys, you can see. Yeah, it's perfect. Now you can see perfectly what we're doing. Augmentation of the chin, and the jawline is one of my favorite procedures for guys. No, I think we're good with this. I don't think we're going to put in more. It's great once it works out. Yeah, look at that. Keeping my fingers away so you're able to see. Put in bolus right there, and you stop. And then you massage. So Rafiq, what we just did now is enhanced you with, I think 4 syringes we used. Was it 4? 4. 2 here, no, I mean 1, yeah, so 2 here, 1, 2, and then 1, 2. I want you to sit up. Sit. Look at that. Hallelujah, brother. All right, so that's how you would masculinize a man's chin. Remember, going back, the chin, more on the lateral side, provide that little enhancement. Forward enhancement is injected here. Downward enhancement, not for him, is injected a little bit inferior. Make sure that the chin is square. Turn this way because they can see. Yeah, perfect. So make sure that the chin is square. After completing this, then you want to recreate the angle. And you can see here the angle. You simply recreate it by making sure that it is at 100 to 110. You can use a caliper, you can use anything, you can visualize it. I tend to just use my eyes, but a lot of people use actually mathematical calipers to kind of move around. Just make sure that the angle there, as I mentioned, is about 100 to 110. Don't make it too obtuse. And voila, you are finished. You seriously look fantastic.
Thank you very much.
Okay.